An increasing number of generic HIV prevention drugs are becoming more widely available. The first generic drug came to market last year, and in the last couple of months, multiple manufacturers have released their own lower-cost versions. But this development in the fight to limit new HIV cases is also shedding light on the financial instability that surrounds preventing the disease. For more, I want to bring in Dr. David Rosenthal. He's the medical director at the Center for Young Adult, Adolescent and Pediatric HIV at Northwell Health. Thank you for being here, Doctor. How has pre-exposure prophylactics, known more commonly as PrEP, changed the trajectory of new HIV infections across the U.S.?
Thanks so much, Lana, for having me. I think one of the important things that we know about PrEP is that by taking one pill once a day, you can actually dramatically decrease your risk of acquiring HIV 99%. And so we've really been able to change the trajectory by decreasing the number of cases and really by seeing the impact of adding a prophylactic preventative medication to stop HIV and to decrease the number of cases.
And I'm wondering if you can help explain the 340B drug pricing program and the role that it serves for many HIV care providers.
Absolutely. So I think that what we're seeing is that 340B drug program is actually a program that's put together by HRSA, where actually some of the funding for patients that are living in areas that take a lot of Medicaid and have disproportionate share hospitals can actually acquire any drugs, not just HIV medications, at a lower price, and then be able to make sure that they can use the extra cost of that medication to be able to help those patients and provide services to those individuals to really provide the needed care that they need to help support those individuals. It's an important program because what it does is it lets us make, I'm sorry.
No, please continue.
It's a really important program because what it lets us do is it lets us take those medications and really provides an opportunity for us to be able to put those funds back into the program and to continue to serve those patients if they're living with HIV or if they have asthma or diabetes or high blood pressure. And since the patients that are being seen are at a hospital clinic or at a disproportionate share hospital or some location which is serving lower socioeconomic communities, it really allows those funds to be put back into the programs and really make sure that they can continue to serve the patients they need to serve.
And so how are generic HIV prevention medications affecting this issue?
Right. So I think that what's happening is that when the price of medications goes from something like $1,700 per a month for a medication down to $24 using generics, the margin is much different. And so a certain proportion of that would actually be revenue that could actually help go to the care for those patients and help provide social workers or pharmacists or other individuals to help care for those patients. But with the generics, what we're seeing is decrease in that overall amount of revenue in some of these situations, which is going to give remove additional resources really that need to be given to these patients. And the system was set up so that we could essentially make sure that patients could have the supportive services they needed from a pharmacy or to get appointment reminders or to have other resources to help them take the medications that they really need.
And Dr. Rosenthal, I also want to touch on the nation's efforts to eliminate the HIV epidemic by 2030. I'm wondering, has the coronavirus pandemic impacted progress and where are we on track for that goal?
So it's a really great question. I think that it's data that we're still looking for. I think the effect of coronavirus, we're still just looking at the very first pieces of this. Data was just released actually last week from HRSA talking about the impact of coronavirus. And what we're seeing is a dramatic decrease in the number of patients that really are getting the resources they need. And coronavirus changed healthcare altogether. But what we're really looking for is we want to take a look at decreasing the total number of new cases dramatically, 75% by 2025 and up to 90% by 2030. And this is a very strong goal that we really need to kind of work towards so that we can continue to decrease cases. And we know that HIV prevention with PrEP is one of those really incredible tools that can decrease the number of cases and make a big difference.
Dr. David Rosenthal, thank you for joining and thank you for all that you do.
Thank you so much.